and welcome back to another video of Medic Notes. This video will be on Alzheimer's disease. It is a progressive neurologic disorder that causes the brain to shrink, also known as brain atrophy, and also cause the brain cells to die. Alzheimer's disease is the most common cause of dementia, where there is continuous decline in thinking, behavioral and social skills that affect the person's ability to function independently, and it often occurs in elderly people. The cause of Alzheimer's disease can be due to environmental or genetic factors, and the cause is usually where there is accumulation of the beta amyloid peptide, which is a degradation product of amyloid precursor protein, resulting in progressive neuronal damage, neurofibrillary tangles, increased numbers of amyloid plaques, and loss of the neurotransmitter acetylcholine. So this picture shows the brain changes in Alzheimer's disease. The left side is a healthy brain, showing the brain nerve cells, whereas the right side shows people with severe Alzheimer's disease. There will be brain atrophy, where there is shrinking of the cortex, enlarged ventricles, shrinking of the hippocampus as well. And you can see that there are the neurofibrillary tangles and amyloid plaques. So who are at risk of having Alzheimer's disease? These are those people who have a first-degree relative who has history of Alzheimer's disease. Those with Down syndrome are more prone to Alzheimer's disease as well. Vascular risk factors like diabetes, hypertension, hypercholesterolemia, and atrial fibrillation. Those with reduced physical or cognitive activity, depression, loneliness, and smoking. And studies have shown that loneliness increases the risk of getting Alzheimer's disease by 2. So it's twice the risk. The symptoms of the patient will include cognitive impairment, which includes memory and verbal skills and also executive functions, lack of insight into problem, which we call as anosognosia, where you can note that the patient, they don't know how serious the disease is, and they might have missed appointments or mishandling of money complained by the patient's family members. Other symptoms include irritability or mood disturbance such as depression or euphoria, behavioral changes such as aggression, wandering around from their home, and also psychosis, where they might say that they see something that other people cannot see, which is hallucinations or delusions. Agnosia, where they may not recognize themselves in the mirror. And for Alzheimer's disease, there is no standard natural history. So the cognitive impairment is progressive. And eventually, many of the patients will become sedentary, where they take little interest in anything. For management of Alzheimer's disease, one of the medication we can give is acetylcholinesterase inhibitor, where some of the medications are donepezil, rivastigmine, and galantamine. We should also control the blood pressure if there is hypertension. This is all for this video. Thank you.